Are you experiencing strange symptoms lately and wondering, could I be pregnant? Or maybe you just found out you're expecting and want to know exactly what's happening in your body during the very first month. In this video, I'm going to walk you through everything you need to know, symptoms, changes, what to do and what to avoid during your very first month of pregnancy. Stay with me. Hi everyone, I'm Dr. Alina Grace and I specialize in women's health, fertility, and prenatal care. If you're looking for clear, trustworthy, and evidence-based advice during your pregnancy journey, you're in the right place. Today, we're focusing completely on month 1 of pregnancy, because what happens in this early stage sets the tone for the entire journey ahead. So why is this video important? Most women don't even realize they're pregnant in the first few weeks. This time is often filled with uncertainty, excitement, and confusion. Hormonal shifts begin long before a positive pregnancy test, and those changes can deeply affect both your body and your emotions. Understanding what's happening inside you right now helps you make informed, empowered decisions for yourself and your baby. Let's begin with what's happening inside your body. The first month of pregnancy starts from the first day of your last menstrual period. Even though actual conception usually occurs about 2 weeks later, yes, that's how it's calculated medically. So technically, during the first 2 weeks, you're not even pregnant yet, but your body is preparing. Around day 14, ovulation happens, and if sperm meets the egg, fertilization occurs. This forms a zygote, a single-cell organism that carries your baby's genetic blueprint. In the next few days, this fertilized egg travels down the fallopian tube and begins dividing rapidly. By the time it reaches your uterus, about 5 to 7 days later, it becomes a blastocyst, which then implants into your uterine lining. This implantation is what actually triggers your body to start producing the pregnancy hormone HCG, human chorionic gonadotropin. This hormone is what pregnancy tests detect, and it's responsible for many of the early symptoms you start to feel. So let's talk about those symptoms. Some women notice early signs within days of conception, while others feel nothing at all until their period is missed. Common symptoms in the first month include tender or swollen breasts, light spotting or implantation bleeding, increased sensitivity to smell, frequent urination, extreme fatigue, mood swings, and nausea, though morning sickness often peaks in later months. Another key symptom is a missed period. This is usually the first major sign that leads women to take a pregnancy test. However, not all missed periods mean pregnancy, and not all pregnant women miss their period right away. That's why understanding your cycle and timing matters so much. Cramping similar to period cramps is also normal and often misunderstood. This happens due to the changes occurring in your uterus as the embryo implants and your body starts shifting gears hormonally. Many women worry about this pain, fearing miscarriage. But mild cramping without heavy bleeding is usually harmless. Now let's talk about emotional symptoms. This phase can bring sudden mood changes, increased anxiety, or even unexplained sadness. This is completely normal and is driven by the rising levels of estrogen and progesterone. You might find yourself crying during commercials or feeling irritable for no apparent reason. That's okay, your body is adjusting to a brand new state. Be kind to yourself. You may also notice heightened emotional sensitivity, perhaps a sense of attachment to people, sounds, smells, or environments. Many women report feeling more nurturing or more protective of themselves. These are instincts developing to prepare you for motherhood, and they're biologically driven. Let's pause here. If you're finding this video helpful, make sure to hit the like button and subscribe to my channel for weekly videos on pregnancy health, month-by-month guidance, and answers to your most asked questions. Your journey matters, and I'm here to walk it with you, step by step. Now let's dive into what to do during your first month. Number 1. Start taking prenatal vitamins immediately. Folic acid is crucial in these early weeks as it prevents neural tube defects like spina bifida. Look for a prenatal supplement that contains at least 400 to 600 micrograms of folic acid along with iron, iodine, and DHA. Number 2, book a doctor's appointment. Even if your home pregnancy test is positive, you'll want professional confirmation. Your healthcare provider will help calculate your due date, recommend blood work, and offer essential early pregnancy guidance. Number 3, start tracking your symptoms and lifestyle. Maintain a pregnancy journal or use an app to monitor changes. Note things like what you're eating, how you're sleeping, your mood, and any discomforts. This record will help both you and your doctor better understand your pregnancy. Number 4, adjust your diet. Eat more leafy greens, lean proteins, whole grains, and avoid empty calories. Hydration is also key. Aim for at least 8 to 10 glasses of water daily. Avoid caffeine above 200 milligrams per day, and say no to raw or undercooked foods. Number 5, rest more. Your body is undergoing massive hormonal shifts and cellular changes. The fatigue you feel isn't laziness. It's your body demanding energy to grow another human. Listen to it. Now, what about the don'ts? These are equally critical. First and foremost, avoid alcohol completely. There is no known safe amount of alcohol in pregnancy. Even early exposure can lead to developmental problems known as fetal alcohol spectrum disorders. Second, say no to smoking and recreational drugs. Both are known to increase the risk of miscarriage, low birth weight, and birth defects. Third, reconsider your medications. Many over-the-counter and prescription drugs are unsafe in pregnancy. Talk to your doctor before continuing any medications, even common ones like ibuprofen, certain acne treatments, or herbal supplements. Fourth, avoid high-heat environments like saunas and hot tubs. Overheating can interfere with fetal development, especially during the neural tube formation phase. Fifth, reduce stress and heavy exertion. While light exercise is great for pregnancy, overdoing it can harm both you and your baby. Yoga, walking, and gentle stretching are ideal. High-impact workouts, or anything involving risk of falls, should be avoided unless cleared by a specialist. Sixth, don't dismiss warning signs. If you experience severe cramping, heavy bleeding, or sharp pain on one side of the abdomen, contact your doctor immediately. These could indicate an ectopic pregnancy or other complications that require urgent attention. Many women ask, can I continue working during the first month? Absolutely. Unless your job involves exposure to harmful chemicals, heavy lifting, or long hours without rest. In most cases, light adjustments like sitting more, hydrating frequently, and taking short breaks can make a big difference. If your work is emotionally or physically intense, it's okay to talk to your manager about early pregnancy accommodations. Your health and your baby's development are the top priority. Protecting your energy now can prevent complications later. Sex during early pregnancy is another common concern. Unless your doctor advises otherwise, it is completely safe during the first month. There's a protective barrier of mucus in the cervix and amniotic fluid surrounding the embryo. However, always communicate with your partner about comfort levels and changes in how your body feels. Let's quickly cover lifestyle adjustments. This is a great time to begin light prenatal yoga, guided meditation, or daily breathing exercises. These support hormonal balance, reduce stress, and help you mentally connect with the changes happening inside. Sleep hygiene also becomes more important. Hormonal changes can lead to vivid dreams, disrupted sleep, or insomnia. Set a regular bedtime. Reduce screen time before bed, and try calming herbal teas that are pregnancy safe, like chamomile. Avoid melatonin unless your doctor approves it. Social support also plays a huge role. Even if you haven't shared your pregnancy news with family or friends yet, consider joining a pregnancy forum or community. These spaces provide encouragement, tips, and comfort that you're not alone in your experience. And finally, educate yourself. Knowledge is power. Read books or watch trusted content about what to expect each month. When you know what's happening and why, you're less likely to be anxious or overwhelmed. To summarize, the first month of pregnancy is a time of powerful biological changes, most of which happen silently. Your body is already nourishing new life, and your hormones are working overtime to build the foundation for your baby's development. You might feel different, tired, emotional, or unsure, but that's okay. What matters most is that you treat your body with care, eat well, rest when you need to, avoid harmful substances, and check in with your healthcare provider. These small steps make a big difference. This month may feel like it's full of waiting and wondering, but it's also the beginning of something miraculous. And knowing how to take care of yourself from day one gives your baby the best possible start in life. If you found this video helpful, please like, share, and subscribe. Comment below with your questions. I love reading and responding to your stories. And don't forget to check out the full month-by-month pregnancy playlist, linked in the description for guidance on what to expect in every stage. Thanks for watching, and congratulations again if you're newly pregnant. I'm Dr. Alina Grace, and I'll see you in the next video as we explore what happens in month 2 of pregnancy. Until then, take care of your beautiful self and that tiny miracle growing inside you.